have been some concerns about the government's response from your end in particular. You'd like to see an increase in the number of intensive care beds across the country.
I think that's the next big issue, and I want to hear what the government's plan is. We need to, all of the experts that I've spoken to have made it clear that we're going to need at least double the number of intensive care beds that we've got. In Germany, they've committed to doubling, and they're working on a plan to put that into place at the moment. They're even looking at creative solutions like repurposing other places like hotels and so on to turn them into ICU beds. Now, I want to hear what the government's plan is on that front here in Australia. I think the government's done, perhaps a little bit late, but the government has done some really good things on social distancing. For example, in Tasmania, where the Greens have been leading the charge there, we've seen some shifts in social distancing just announced this morning, which we support. And we support the government's moves with respect to social distancing to date. But the next thing is going to be how we manage when large numbers of people start presenting to ICU. So the first thing, and we're calling on the government today to become clear and outline their plan to double the number of ICU beds, because all of the health experts are telling us that just like in Germany, that is going to be one of the things that makes a difference, literally, as to how many people will survive the more acute phase of the crisis.
There surely would be a limit, though, to how many beds that the government could physically get together but also afford to put together.
Well, what we've seen is the government rightly say that the priority at this point is minimising the number of people who die as a result of the coronavirus, and we've seen the government again correctly decide that reaching a surplus is not the priority. Instead, it's keeping people alive and keeping the economy going are the key priorities. Now, as part of that, there has to be a plan for doubling the number of ICU beds. So if we're looking at measures to increase capacity around testing and the like, which are being looked at, then we've also got to have a plan for increasing the number of ICU beds.
And you also want to see in these stimulus measures that will go through the Parliament next week help for people who might not be able to afford their housing and also the arts industry.
Well, housing is a crucial issue. I mean, people are being asked to self-isolate. That requires having a stable home to self-isolate in. Now, I've got people here in Melbourne that my office has been helping who are currently homeless. We've got pregnant women who are due to give birth in the coming months without stable accommodation, and they're now doing it in the context of the threat of coronavirus and potential social isolation measures. So there could literally be people sleeping on the streets. So a good short to medium term solution for that is to deal with the looming economic downturn with an immediate commitment to build 500,000 new homes over the next 15 years. Start doing that sooner rather than later, because the homelessness crisis could potentially get worse. But in the immediate term, we need a freeze on evictions. That's especially important for renters. No renter should be evicted, because renters are more likely to be people who are doing casual work. They're the ones who are more likely to be hardest hit. No landlord should be able to kick anyone out. Similarly, I notice in the United Kingdom, for example, Boris Johnson has been talking about holidays, mortgage holidays as well. And I think that in this time of crisis, people expect the banks not to be bastards. And I would be calling on the banks, but also the government, as it sits down at its national cabinet, to ensure that no one is evicted during this crisis.